primary promise: building the nation's model health system for children. As children grow into adults, it's important for them to learn how to manage their own medical needs. And that's more complicated when you have a complex medical condition. As part of our primary promise to build the nation's model health system for children, our Teen to Adult Care Transition program teaches vital skills, self-advocacy, transferring to new providers, and navigating the adult care model.
Transitioning from pediatric care to adult care can be a challenging time. This is the same time there are competing priorities: going to college, taking over new jobs, they're becoming financially independent.
How do we start getting the adolescent patient more and more aware of their condition, aware of the responsibility to make good decisions around their condition, and frankly, learn more about your condition so that you can have some judgment around what you do and you don't do?
Research has shown if there's not a formal transition process, the teens and young adults can often get lost to follow up and have worsening of their healthcare conditions. This highlights the importance of not just having a transfer, but really having a program that ultimately leads to transfer. Diabetes is a chronic disease. It's also a complex disease. And with type 1 diabetes, you're insulin dependent for the rest of your life. It is important to teach the skills for how to check your blood sugars, when to check your blood sugars, how much insulin to give, self-management. And I would also highlight self-advocacy.
Our role is to help teens make a smooth transition to adult medical care, empowering them to take charge of their own health. We spend years and immense effort supporting our patients when they are young, and we want to ensure that they can thrive as healthy adults.
When I got diabetes, I was 7, and in the first couple of years, the doctor or my parents put my Dexcom on for me. But now as I've gotten older, I can do it myself, and I know how much to do. It feels easier to ask the doctor questions and talk for myself.
My name's Cecile Awayo, and I am the Administrative Director for Transplant Services. It's really important to have a good transition to the adult care for these children that have received their transplant, because having suboptimal transition to the adult care really increases the risk of them losing their precious transplants. So at 10 to 12, we start talking about how to navigate the healthcare system, dealing with insurance and co-pays, understanding the side effects of medications, and even as simple as how to plan a heart-healthy diet. The one thing that's really unique to our program is that we do a physician-to-physician handoff. Their last clinic visit here at Primary Children's, the nurse from the adult program comes in, and then their first visit with the adult program, our physician is part of that clinic visit. One of our patients, Landon Liston, he is one of those patients I think will be very successful going through this program.
My name's Landon Liston. I'm 17 years old. I'm a senior, and I have hypoplastic left heart syndrome.
The first time I held Landon, he was 2 days old, and it was right before he was headed into very complicated open heart surgery. I was able to hold him for a few minutes before they took him down to the operating room.
The first time I held Landon was probably at 7.5 weeks old, when he finally got off a ventilator and was a little bit more stable, and that was the first time I held him.
His heart, about 1.5 years ago, started to fail.
Leading up to my heart transplant, I was pretty sick the couple months before. I was just super tired, even from just doing little things.
We knew he would have to have a heart transplant sometime in his life, but it just happened sooner than we were hoping. Primary Children's has been amazing, helping us transition from Landon being pediatric to now moving almost to adult.
As a younger child, they would always talk to us and ask us questions and explain things to us. And now you can tell it's about Landon, and asking Landon, do you understand? Is there something that you don't quite get here? What is this medication for? And what happens if you don't do this?
In the U.S. healthcare system, there's no funding structure for these types of transition services, and no single entity responsible. Simply put, there is no one else, and we need your help. Our generous community will play a key role to ensure young people with chronic conditions become adult survivors, confident to take charge of their own health and lives.
If we help the adolescent make an effective healthcare transition from adolescent care to adult care, that is a lifelong gift. That has an impact that is going to position that young adult to do really well for decades. There's a really strong commitment at Intermountain Primary Children's Hospital to pay a lot of attention to that transition and what needs to go into it across all of the different typical clinical programs that a children's hospital has.
The caregivers, the doctors, the nurses, the whole team that have dedicated their life to save people like Landon. It's beautiful, and we're forever grateful.